first, a local organization making a big difference in the lives of children in China. And here to tell us all about it, Gena Palumbo is the president and co-founder of the Children of China Pediatrics Foundation. Good morning. Nice to meet you.
Good morning, Antoine. Great to be here.
Tell us about the foundation, G.
Sure. What we do is we send medical volunteer teams to China to operate on disabled orphans who have been abandoned because of their disabilities by their parents to the orphanages. We go and we provide medical care for them by doing medical surgical procedures, also providing rehabilitative care in the orphanages themselves. And we're just about to launch an infectious disease program where we will be working with the orphanage staff to improve the conditions in the orphanages that take care of the children.
What type of disabilities is it that they're treating?
It's a wide range. So it is from things like scoliosis, not the kind of scoliosis that you or I may have seen in school where somebody needs to wear a brace or something for a couple of months. This is very severe scoliosis, such that if the children aren't operated on, they will likely either be in a wheelchair the rest of their lives or die because the condition is so crippling it results in pneumonia. It can be a child that's missing an ear, so we actually build a replacement ear for the child. It's maybe a stigma that a lot of people could live with, but when you think about it, to not have an ear is actually quite disabling and quite a difficult social situation for them to deal with. Other things are more like urological conditions and other general surgeons for the children, highly complex conditions that we work on.
When you mentioned the mission, my face dropped. You said these children have been abandoned by their parents?
Yes. I mean, what happens is that if a child's born with a disability, there are many parents that don't have either the psychological or the financial wherewithal to be able to take care of them. And for many of those parents, it's a very heart-wrenching decision to give their children up to institutional care in order to make sure that they at least get some basic care to help them with their disabilities.
I couldn't begin to imagine that, but I guess you made a point, like if they couldn't physically, are not in a position to do so. But I think my initial impression was just like they saw this disability, or this child was imperfect, and just handed them off to someone or an organization to do. What inspired you to get involved with
for
this?
most people, for me also, this was a very personal mission. Both my children were adopted into our family, and for my youngest daughter, she was born in Nanjing, China in 1995. I went and adopted her in early 1996. She's perfectly healthy, a college senior, just about to graduate. But I knew when I brought her home that I was leaving many, many children behind who were not nearly as fortunate. And so it was important to me to give back for the gift of my family and also to see whether I could make a difference in these other children's lives. So, there are many organizations that send volunteer doctors and nurses around the world to help disabled children. But at that point, there were very few organizations going into China, and I thought, why don't I try to start one and see if we can help these children? So that's how it began. I worked with the doctors at Columbia Presbyterian Babies Hospital, it's called at that point. Many of them were interested in going to China and helping these children, and so we compiled all the equipment we needed for an OR, got the permission of the Chinese government to come and start our first mission back in 1999 to Harbin, China.
You've been doing it since '99?
Yes, I know.
Look at you, Gena. Wow.
It's sort of amazing when I think about that. But yes, we have year after year gone. There were 2 years when we weren't able to go. One was right after the Iraq invasion in 2003, and then later on, 2009, there was an unfortunate bird flu epidemic going on, and so the hospital asked us to delay our trip. But we've gone every year, and many of the same people that were on the first mission still go with us today.
This is a tough question. How many surgeries do you think that you and the organization have actually been involved in?
Well, probably about close to 1,000.
Wow.
But the fact of the matter is that we've actually impacted many more lives than just the children that we've helped through surgery, because we have other programs that we've built out through the years. I mean, one of the things that I always noticed when I would go to visit the orphanages is that there are many children that are there have really chronic disabilities such as cerebral palsy or muscular dystrophy, and they're not really necessarily great surgical candidates. But what they are good candidates for is rehabilitation medicine. So about 6 years ago, we expanded our program with a rehabilitation team. And they go, rather than our doctors on the surgical side work in the local hospital side by side with their Chinese colleagues, our rehab team goes directly to the orphanages and works with the orphanage medical staff to care for these children in terms of how to seat them properly in a wheelchair so they're not in pain, how to drink from a cup, how to hold a pencil. So they do a tremendous amount of work for hundreds of children through this program as well.
I also understand there's a sharing of information between the two countries, the two medical teams. You explain that for us.
One of the things that I was most interested in doing when I started this program was to have it be a bilateral effort where we were working closely with our Chinese colleagues so that we were sharing information and there was diversity of thought in terms of how to approach these surgeries. So from the minute we get there, they examine the children with us, they decide which surgeries which will take place, and they operate, hand side by side with us. They also help recover the children, and when we leave China to come back to the States, they are dealing with the ongoing care of those children. So that's been a tremendous educational effort, back and forth between both sets of doctors and nurses. And then we also bring about 5 to 6 medical professionals, both from the hospital and from the orphanages, here to the U.S. for training right here at New York Presbyterian Hospital. And that's a terrific program as well because it's another opportunity for the Chinese doctors and nurses to see what we're doing here in terms of patient care administration, and they sort of carry that back with them when they return back to China.
Tell us about this big event you had that's making me smile right now, involving someone that I know very well.
Yes, Teresa, your co-host, was there with us. It was a great event. We had it at the Mandarin Oriental Hotel, raised a lot of awareness, raised a lot of money, and just a terrific evening. And Teresa did a great job.
She does. I like her. We'll keep her. If anyone is interested and want more information about what they can do to help further your mission and your cause, what is it that we need to tell them, Gena?
They should go to our website, ChinaPediatrics.org. There's so many opportunities to help us. We need translators. We need financial support. We need medical people who want to go and volunteer. There's all kinds of opportunities for whatever people want to help us out with. It would be great to have more people involved.
Bless you for what you do, my dear.
Thank you so much, and thanks for having us on.